Thank you for staying with us on this segment. Right now, we'll be discussing the fastest growing health concern, diabetes. And this is one health concern that is affecting not just Nigerians, but it is a global issue with implications on individuals, families, and of course the healthcare system. And joining us to, break this down and give us updates on what is really going on as regards this health concern. We are joined by Dr. Lilian Ochayi. She is a resident doctor at LUS and the PRO Association of Public Health Physicians of Nigeria, Lagos branch. You're welcome, doctor.
Thank you very much.
So talking diabetes now, give us what's the current situation of this health concern in Nigeria?
Yeah, currently we're having rising numbers. Currently, recent data is showing that we're having like over 10 million people that have been diagnosed and are currently managing. But of course, because of diabetes and the way the condition tends to come up, there are a lot of cases that may go undiagnosed that we may not be able to find out on time. And then the moment people start to want to go run tests is usually maybe when some of these complications have started to come up. So I'm sure that number that I mentioned, it doesn't quite cover, the actual number or represent the actual number of people that actually have diabetes, because like I said, a lot of people may have it, but they don't know yet because they've not had tests done and all that. And it's also very similar to hypertension in a sense that it can also be referred to as a silent killer in that sense, right? Because if they do not check their blood sugars, they would not know early enough, and then when those complications start to happen, it may get to the point where some of them may be irreversible.
Taking it from the point where you said a lot of people might have it and may not know. So now let's break it down. Let's talk about what is diabetes. What is it? How does it affect the body?
Yeah. So, of course, in managing anything at all, we need to, of course, understand what it is. So, diabetes is a chronic disorder. It basically, when our body is not able to utilize, so for instance, we're not able to metabolize glucose, right? Yeah, so in this situation, it means that excess sugar is in the blood and it's not being taken up into our body cells, right? So with this condition, we then start to have what we call hyperglycemia, which is basically high blood sugar, right? And there's mainly two types, type 1, type 2. So type 1, basically, it occurs mostly in children, young individuals. It's a form of like an autoimmune situation where it's like the body is affecting itself and destroying the cells that produce insulin. Insulin helps our glucose to be taken up into our cells and not just kept in the blood. But when there is no insulin, this glucose just remains in the blood, and that is where the problem is.
Sugar.
Yes, when we eat food and take those things, they're supposed to be later broken down into glucose and be used as sources of energy in different parts of our body. But when insulin doesn't work well, this glucose is not able to be taken into the cells, and our body cannot utilize this glucose as it should. So it's now just accumulating in the blood, which should not happen, right? So for type 1, in that situation, there's very little or no insulin at all. So they are not able to even get their glucose up into the cells. Then for type 2, this usually is, we term it insulin resistance. So over time, the cells that produce insulin start to become burnt out. So they are not releasing insulin as they used to. And then because of this, blood sugar, just keeps accumulating in the blood and it's not being taken up into the cells for our body to use. And this usually occurs as people age, right? And even obesity, being overweight, some of these things are what lead to type 2. Yeah.
Okay, when you started this major public health challenge, diabetes, you said the numbers keep going
rising
up. They keep rising. So what are the factors, that causes these numbers to keep going up?
Right, thank you. So while I was, explaining what diabetes was, I did mention some of this, we term them risk factors, right? So things that put people at risk of coming down with diabetes. We have them grouped in 2 different forms. So the ones that are modifiable, the ones that are not modifiable, in the sense that modifiable ones are the ones that we can change, right? We can make changes to these risk factors. And then the other one, these are the ones that we really have no control over. For instance, aging. People will definitely grow old, and there's nothing anyone can really do about that. From 40 years up, their risk of being diabetic increases. And then another is genetic, family history. So a person comes from a family where maybe the father was diabetic, or someone in the bloodline was diabetic. It puts them at risk of being diabetic. And then moving to the modifiable factors, we are definitely looking at weight, being overweight, obese. This is one major risk factor. Physical inactivity. So people just, and we have a lot of that going on now. We move from here to the car, from the car you drive to this place, and then you're at work and you're sitting, and then you go back home and you sleep, and then
take for those that go to work in high rise, you go through the elevator instead of taking the stairs.
Yes. So this physical inactivity is also one major concern, and also diet. Right, we're taking up more, like a lot of people. Of course, we're in urban environments and a lot of fast-paced environments. We need to work, we're stressed, somebody just needs to throw in some snack, those kind of things. So taking in highly processed food, foods containing lots of sugar, things like that. So processed food and all that, so they increase our risk.
It's not the sugar.
It's not the sugar, because I was going to ask you.
I will speak to that.
Okay, that is not the sugar we are taking. Okay, you also said something earlier that some people do not know that they have this diabetes until it becomes complicated. So apart from the tests, what else should one look out for in terms of the way you feel?
So you may not get a feeling that would make you know
that you have this.
And that is why I said it's somewhat similar to hypertension, in the sense that we can also say it's like a silent killer. Because you would not, same with hypertension, you would not, some people feel like maybe when their blood pressure is high, they would know, there's a tell, there's a sign. Sometimes it may not. The times where you might see a sign is when it's getting to
really
that
bad.
Yes, that bad state, that complicated state. That's when in some cases the signs come up. So it's just for instance, now an important reason why we're having things like this is so people are more aware, right? You asked about the risk factors. So if I know that risk factor of being diabetic means from 40 years upward, my risk increases, or I'm overweight, right? Or I know by myself I'm not eating healthy, I'm taking lots of processed food and all that, then they start to think that, okay, what do I need to do? I need to check this. I need to put in steps. And that is why creating awareness is very important, especially for conditions like this, because it might not just come up written on the person's head that, I am. You might not just tell unless you check, just like hypertension, unless you check the blood pressure, you may not be able to tell that, okay, something like this is going on.
So I have a worry now, because you have said there might not be warning signs. And you talked about the type 1, which is common in children.
Yeah.
So how will a parent know that the child is down with diabetes?
test. So you know, I did say that it's also genetic, right? So it's possible.
At what age?
So these things tend to, for children, it can happen in children, it can happen at teenage years, it can come up at different times, right? So in those ones, definitely it means that, and some of these autoimmune conditions, they may not happen from birth. They may just come up sometime in their childhood, randomly, right? So when we speak about autoimmune conditions, it's basically like the body cells just attacking its own self, seeing itself as an enemy instead of, you know, fighting off other intruders. It sees itself as an enemy and then now starts to destroy the cells. So there might not be a specific timing to when it occurs, but we do know that with type 1, it does occur in children, and then, you know, that is what young adults, kids, teenagers, and things like that. Then for what you were saying about signs, of course, you know, when they start getting to complicated stages, because of the accumulation of the sugar in the blood, it now starts to affect, we have microvascular, macrovascular complications. So it can affect the eyes, cause some form of what we call retinopathy. It affects the eyes, can affect the nerves, they lose sensation, you know, things like that. And then I'm sure you've heard of cases where diabetic patients have
injury,
ulcers on their foot,
and then heal.
Yes, and it doesn't heal. And in most of those situations, they have an injury and they do not even know because that area is somewhat numb. This is usually due to damage to the nerves from diabetes. So that, you know, and that's why usually they say check your foot regularly, because something might have happened.
Check your foot. Okay.
Yes.
I'm trying to see if I can feel all parts of my feet.
Especially if someone is diabetic. Yes.
You don't have feelings.
Do check your foot. So it depends on the level of complication. Not everyone just comes up with that complication, but it's a common one, right? So usually they say check your foot. So if there's an injury, you're not missing it. In some cases there's an injury, then they did not feel, you know, when it happened, and then because of, again, the high blood sugar in the blood, wound healing is not great in diabetic patients, and so it just tends to worsen and even get to the point of amputation in a lot of cases. So these are, you know, these things tend to come up as complications when the blood sugar is not well controlled.
Now let's look at, since we've talked about causes and symptoms and early detection, now let's look at prevention and lifestyle. So I'll start with diet. So what role does diet and nutrition play in preventing or even managing diabetes?
So diet is, you know, one key thing, and you know, you already said, or was it her that was going to ask about the sugar thing? Because once people hear diabetes, they're like, sugar, why are you taking so much sugar? Like, it's like your intake of actual maybe
the
sugar,
sweet sugar we add to our tea or our gari, and then beverages, like I don't want to mention any brand now.
And chocolates.
So usually that's what people think is this, but no, it's not. So taking those sugar and stuff like that is not directly a cause of diabetes. It doesn't cause it directly. So when we say limit your sugar intake, it's because generally it increases your caloric intake. So there's now high calorie in, you know, the person's body at that time, and then can lead to weight gain. And you know, I said weight gain is high. People that are overweight, that puts them at risk of being diabetic. So it is the gaining of the weight, it is the food you're taking that leads to weight gain that is basically what we're saying limits the sugar for. Not that the sugar you are taking is what is causing it to be high, but the high sugary intake can lead to high calorie in the diet and also lead to weight gain, and weight gain is directly a cause of diabetes.
Okay, from your experience, apart from the apart from the sugar, physical sugar, the sweetening sugar that we take, I've heard over time that, you know, even our rice, even our carbohydrates, okay, in general, has sugar.
Yeah.
Okay. I want us to be, I want you to enlighten us about that, because that is what food intake, you know, majorly consists. Carbohydrates.
Yeah.
The rice, the eba, the semo, the amala,
even beans. They say beans is carbohydrate.
Yes, beans is carbohydrate, but we were mistaught in school that it was protein. So, you know, all the food we take, you know, is or are all carbohydrates. So how do you now manage
balance
that?
the diet?
Yeah, so with what you said, yes, there's sugar and those forms in different diets that we eat, even the ones that we feel like, how is there sugar in this thing? Even tomato paste and other things.
Thank
like
God
that.
I don't use that.
So the thing is, there's definitely sugar in a lot of things that we eat, right? And in amounts that we may not even know. And that is why in managing diabetes, they usually preach portion control, right? So that you are not overburdening your insulin that is already not working so well, right? So basically, for what you're asking, yes, there are different, for carbohydrates and different other forms of food, they do have their sugar in them. And you know, like I said, when we eat food, any food we eat, the body wants to try and break it down into glucose so that our body can use it.
Okay.
So where the challenge now is when that insulin that should help us transfer this glucose to the cells for it to be used is not functioning.
Hey.
Yeah. So that is where the issue is, right? So it is not really that, oh, you are just like I was talking about, it's not like I'm adding so much sugar to my tea and that is what
sugar.
No, it is just generally what it does to the person's weight, and when the person gains weight, and then that in turn now puts the person at risk of being diabetic.
Okay, let's talk about those who are living with this condition. You wanted to say something?
Yes, for those people, you know, there are some people who don't gain weight.
Whatever they eat,
you know, there's some
remain
people
the same.
who don't gain weight. Does that mean that they are free from this health concern?
No. So, you know, I did mention other risk factors.
Okay.
The only weight gain is not the only. Yes, you know, I did mention age. I did mention family history. Yeah, just having it in your bloodline puts you at risk.
Okay.
Yeah, and also diet, of course, diet linking to that, physical inactivity and all that. So yeah, so it's not just that weight gain is not only for overweight individuals. Yes.
Okay, for those living with this condition, now let's talk about the treatment and management options and how affordable is it, especially the insulin.
So yeah, okay, so for management, of course, for a person to be diagnosed, they have to run tests, blood tests. We have fasting blood sugar, random. There's also one called HbA1c. So basically those ones help us to know if the person's blood sugar is within a normal range, if it's in the high range, if it's done repeatedly and it's still high, then we can make a diagnosis.
What are the numbers? How do you know high, normal?
Yeah, so there's different, for the fasting there is a range, for the random there is a range, for the HbA1c there is a range. So of course when a person goes to the lab, they have those parameters there, and then you do your test and then they check if it falls within those ranges. If it's higher than the normal range, then of course if they might need to repeat the test and then come to a conclusion. Then in forms of management, depending on the type of diabetes, the management is different. Like for type 1, where I said that there's usually autoimmune condition where the cells that produce insulin are destroyed, right? And there's very little or no insulin. So that means we need insulin directly. So for type 1, insulin is what is usually given. But for type 2, where, you know, I said the cells that produce insulin, over time they get worn out, and then they're not producing insulin as they should. So there's now resistance. So insulin might even be produced, but the body is not even making use of it the way it should. So in this case, medications can be given, right? And diabetic medications, there's different classes of them, right? Metformin is one of the most common ones that is being used, but there's other classes of medications that are used to treat diabetes. And then in some cases where, you know, even these medications are not as effective anymore, they might also now start to use insulin also. But because we know that insulin is directly what the problem is, it is basically the key to this blood glucose entering the cells, not entering the cells. So when these medications are not controlling it as much, they would now result to using insulin.
Okay, we're still talking about treatment and affordability and availability. What are the treatment options that, you know, patients, should I call them patients?
Yeah, if a person is diagnosed, then yes, they're patients.
So what are the treatment options, and how affordable or how available are they?
Yeah. So I believe I already touched on the treatments for depending on the type of diabetes.
Let's look at affordability.
Yes, affordability, of course, they're not so affordable, right? And, you know, because we say that this is a chronic condition, it means they're managing it for long periods, and currently there's no cure for the condition. It's something that is just to be managed, and it means that people have to be on these medications for the rest of their life once diagnosed. So it is not affordable, as we know, and because of this, a lot of people drop out of, you know, they are not consistent, there's no compliance, because today they can afford, maybe when they get money the next time it's 2 weeks later. So this is the challenge, right? This is why we are having and this is why complications to also even happen in people that are already diagnosed, because they may not be able to keep up with these medications on a regular basis. And even for insulin also, it's also, you know, for the regular person having to take those medications also as regular as they need to, they might not be able to afford it. And that is why, you know, a lot needs to be done from the government, right, in finding ways to subsidize these medications for people that have been diagnosed and are managing. Sorry?
I think President Tinubu has, you know, announced that.
Okay.
I don't know.
Is it being implemented?
I don't know if it's being implemented.
Yeah, so there's a lot of, like in Nigeria, we have so many policies.
Yeah.
There's guidelines and things like that, but are we actually like acting on most of them?
We're supposed to act on them when the president has, you know, announced it or given the directive.
Yeah, so there's been given a directive, and then people in positions of power that are responsible for these things should now take the further step to ensure that these things are being implemented. And they need to, of course, revisit to see, is this being done? But if it's just been mentioned and it's up in the air and nobody is going back to see, okay, what are we doing about this, or is this actually being carried out, then it just, you know, goes up, and then we're actually not having the impacts that we should have on that front. And, you know, so basically having those policies is just like something on paper without actual actions. And these are the things that would help in even reducing the burden of diabetes.
Okay.
Yeah.
I haven't talked about treatment. We haven't talked about causes, treatment, now, and management. For persons who have not been diagnosed, with diabetes, how can it be prevented?
Yeah, okay. So in prevention, we are basically looking at what we know the risk factors to be, and then using that to now say, okay, so I don't get this.
Okay, those risk factors.
So I don't get
lifestyle,
so
diet,
I don't get
and
this.
nutrition.
I know these are the things that puts a person at risk of getting it. So I did mention that there are some you have no control over. Of course, you cannot stop yourself from aging. You cannot change your family.
For the ones that comes with genetics.
Exactly. Yeah. So, but for the ones that we can control, physical inactivity, of course, exercise, right? Well, at least 150 minutes of moderate activity in a week. You can spread it out as you like, right? If it's jogging, if it's walking, if it's doing jumps in your compound, if it's, just something to get the body active, right? So very important. And then as much as possible, like, we're talking about sedentary lifestyle, how people from work on their laptop and then to the car and to the house. Sometimes you can just decide to walk. If it's a short distance, just take a walk, or, instead of just looking for convenience all the time, right? And then our diet, another very important aspect of it. Less processed food, less fast food, and even fast food also includes even like eating out. Sometimes when you eat out, what they put lots of salt and things like that. You cannot control because you're buying it, and of course they want it to be tasty for you to buy. So it's not only about snacks; it's also even food that is being bought outside, because they also contributes to unhealthy diets, right? So controlling that, taking processed food, balanced diets, lots of fiber, fruits and vegetables, things like that. So these would generally just help to keep the body in good shape, and also to just keep the body healthy, strong enough to be able to fight off some of these things when we are exposed to them. And then also maintaining like monitoring our weight, right? There's something we call BMI, body mass index. So there's a range for it. The body has I see your face.
Because getting to my own BMI.
So for the BMI,
do you have some kind of disease? If I lose weight that much, and trying to get the target of my own
your normal range.
My normal range, it is a tough one.
Yeah, it usually is a tough one, especially like when someone is trying to reduce, so it's actually like on both sides actually, but being within the normal weight range. For the BMI, we know that it's calculated using the person's weight and the person's height. So then with that, there's a range. Normal range 18.5 to 24.9, right? So if it's higher than that, we have overweight.
We're all obese. No,
there's different categories. If it's higher, I will not be able to remember the exact numbers, but I know the normal is up to 24.9. From 24.9 up, overweight, and then like from 30 up, obese. And even obese has its own classes. There's 1, 2, 3. Yeah, and then there's also underweight if it's below 18.5. Yeah, so maintaining that weight, healthy weight range is also quite important, so that we do not expose ourselves to this kind of non-communicable
Just
conditions.
before we go,
I still have one more question.
What are the major misconceptions you have about
misconceptions
that? Oh, that's what you wanted to ask. Oh, sorry.
Yeah,
misconceptions,
and for someone,
I've heard it so many times, and they say it's a big man
sickness.
Do you hear that?
Yeah, I have.
Why is it referred to as that?
Yeah,
maybe because of the management,
the name,
not the name.
The treatment.
To manage the condition, you need to spend money on medication?
So I know I've heard that actually, but it's not. I think it's for like we said, diet and all that. It's for people that, of course, for the ones you can control, it's people that do not pay attention to these things, put themselves at risk. They're at risk of coming up with diabetes, and it has nothing to do with your financial status or anything like that. Fine, it may be, for them, it may be more easily detected because they have better access to healthcare. They can afford it, right? For them, so it might seem like it is their thing, because if a well-to-do person can just go to the hospital for checkup and then find out from there, oh, they tell you you're diabetic and then you're managing it. But for the people that are not so
buoyant,
yes, so buoyant financially, they may not be able to detect these things, and they just go on with their lives, and they might not even know until something happens down the line. So it's really not about a person's income or how well they're doing financially.
Just a short one now. So for someone who has just been recently diagnosed with diabetes, what is your message to that person, knowing fully well that there is no cure?
Right. So for someone that's been recently diagnosed, it's just important that you understand what you've been diagnosed with and then know what to do. It's not in every situation that it gets to the point. And it's like, I'm happy that you now know. That's what I would say, that I am happy that you now know, because it starts from knowing, right? Even in levels of prevention, there are different levels. Before we don't want you to have a condition. We also, even if a person has the condition, we don't want it to progress to the point of complications or where we have to have amputations or death. So it's good that the person knows now, and then you're taking action. So what I would say is, please take your medications, right? Ensure that you are monitoring your weight, ensuring that you are having regular physical exercise activities and all that, which they also help. And then just being, of course, there's also diets and management also included in diabetes treatment. So staying strictly observing these diets, because medications alone are not going to work in managing diabetes. Some people feel, I'm taking the drugs and that is it. No, we also have to do lifestyle modifications, be physically active. Our diet also has to support these medications that we're taking.
Oh, thank you very much, Dr. Lilian Ochayi, resident Dr. Los Piero, Association of Public Health Physicians of Nigeria, Lagos branch. And we've been talking about diabetes. It is a health concern, and the numbers keep growing. Doctor has, talked about it extensively on how to manage, on how to prevent, on how to prevent it first. Keep a healthy lifestyle, don't drink too much. And when I say don't drink too much alcohol, don't eat
we didn't even talk about that.
We don't talk about that. Don't do everything in excess.
Everything should be done in moderation.
Anything you need to do it in moderation to have a healthy lifestyle, not just for diabetes, also blood pressure and every other health concern. Thank you once again, Dr. Lilian Ochayi. We'll go on a short break. When we come back, we'll have the second conversation.